Mark Reid, Senior Director of Cardiac Services, fully responsible for the business and strategic direction of the company and responsible for 90 staff throughout Ireland and the UK. Cardiac Services started business here in Belfast in 1969 and became part of the SISK healthcare group in 2006. We supply high quality technology equipment into the healthcare sector. We currently have 25 engineers in the field and 5 clinical application specialists. Our company tagline is putting service at the heart of healthcare, and we truly do live and breathe that concept.
My name is Richard Ellis. I'm the Director of Service Education and Cardiac Services. Within the medical industry, there's more and more regulation, more and more documentation required, and we were starting to try and roll that out in a paper way, but it wasn't really very effective. It wasn't really possible via paper, so we needed a much smoother, much slicker way of doing it. We realised that the solution to our problems lay in mobility. Paper had to go. It had to work well with Microsoft Dynamics. That's our ERP system. That will be our ERP system. We didn't want a separate system trying to link into it. It had to integrate well with it, and that was one of the big values that Sysco mobile solution brought to us. So it had to be a live system. We had to have a 3G, 4G capability. We wanted customers to see the electronic service reports landing right on their desk after the job was finished. We spoke with the team in Sysco, looked at the solution ahead, spoke to some of their customers. We're really pleased with what it could do and also some of the future potential with it.
My name's Nita Walker. I've been with Cardiac Services for about 7 years now. I am the Service Support Team Leader and Customer Relationship Specialist. Before the mobility solution came in, the engineers would fill in manual service reports. They'd have to fill in their time, their labour, parts. So then when the service support desk would receive the paperwork, we then have to upload all of this information into Navision. With the mobility support solution, that has eliminated the need for the service support desk to upload this information. We have it all automatically via the tablet. The mobility solution has now allowed engineers to complete their jobs instantly. Before the mobility solution, we would have had to wait till the engineer comes back to the office. Now we instantly have job completion confirmation. We know that a job has been completed for the customer, and we can then instantly invoice them because we have access to the engineer's report straight away. Another benefit that we'd find with the mobility solution would be job assignments to the engineers. With the mobility solution, we can send notifications through to the engineer instantly. They can accept the call, they'll be able to tell us when they're going to call out, give us a time and date for the customer. We can easily see with the mobility solution equipment that was serviced, equipment that was removed, the location of the equipment, the serial numbers. Whereas it once would have taken me days maybe to do one contract renewal, it can now take me just up to hours to do it.
My name's David Finn. I'm a field service engineer for Cardiac Services. Sysco Mobile Solution has brought an amazing change for my day-to-day life in service. Previously we were using a paper-driven system, which worked, but it was very cumbersome. Now with the mobile solution, I treat it as a window into Navision. The mobile solution to me just focuses on the salient points that I need out of Navision. So it's very flexible and I think user-friendly. All the information I need, as far as work to be done, parts, facilities placed in order, check stock levels in the boot, check stock levels actually live in the warehouse. It's very, very useful. Every morning the tablet produces for you is a list of our test equipment. If it's out of calibration, it's highlighted. It's a must that all our equipment that we use is kept calibrated, and the tablet allows us to keep an eye on that. Whenever we get work completed, it's signed off on the tablet. And I think it's within 15 minutes, it's an email of the service report is sent to whoever the agreed recipient is within the hospital. The mobile solution relies on 3G, 4G cellular network, and it works in the rare occasion that some hospitals within the country don't have Wi-Fi and we don't have cellular coverage. It does continue to record information on the background at the end of the day, from home or whenever we get a network connection again. And any work previously done is then uploaded and synced back into Navision.
We had our project team, Sysco had their project team as well. The two teams work really well together. We had one company doing the integration on both sides, and that I think is one of the keys to it being such a smooth rollout.
The mobility solution has really helped us provide a good service for our customers. It's all part of our continuous improvement plan. The future would be to roll the mobility solution out to our sister companies within SISK Healthcare.